A question that I've frequently encountered in my career as an exercise physiologist in the cardiac rehab department is a patient saying to me that I'm here because I've recently had a heart attack. My doctor found that some of my major coronary arteries are very occluded, but fortunately they were able to stent them and I was able to avoid having open heart surgery to bypass the vessels. Moving forward, would like to improve my coronary artery disease and reduce my dependency on cholesterol lowering drugs by losing weight and improving my blood lipids. My doctor suggests that I start making healthier choices with my diet and begin to exercise. I know that cardiac rehab should help me start moving more and being more physically active. But what is the best type of diet for me to help me lose weight and to reduce my obesity? I would say that if you're interested in creating a personalized meal plan or diet plan, I would advise you to meet with one of our registered dietitians here at this facility. They can help you by providing you with nutritional assessments as well as individualized education and meal plans. Within my scope of practice as a cardiac rehab exercise physiologist in this facility, I'm allowed to provide my patients with general nutritional education, such as heart healthy food choices and modifications, but I'm unable to provide many specifics, such as specific caloric intake for the day, macro allocation, and providing meal plans and medical nutrition therapy. However, since this cardiac rehab department follows the protocols and procedures provided by the AAC-VPR, which is the American Association of Cardiovascular and Pulmonary Rehabilitation, the RNs, exercise physiologists, exercise specialists, respiratory therapists, we're all advised to cancel and educate patients on diets specific to improving cardiovascular health. This also includes guidance for weight loss, as obesity and high fat accumulation around the abdominal region are characteristics of metabolic syndrome, and having metabolic syndrome increases the risk of heart disease, strokes, and diabetes. Although there isn't one single best diet for losing weight, ultimately one that can be sustainable and long term will end up being the best diet for any given individual. For those without chronic kidney disease, research suggests that increasing protein intake and decreasing carbohydrate intake, especially in combination with caloric restrictions, could help facilitate weight loss while preserving fat-free mass. In an article from 2006 written by Krieger, Citrin, Daniels, and Henkin, they performed a meta-regression study of the effects of variation in protein and carbohydrate intake on body mass and composition while consuming a calorie-restricted diet. During this meta-regression analysis, they found that diets consisting of a carbohydrate intake of less than 35 to 41% was associated with greater loss of body mass, fat-free mass, and fat mass than diets with a higher percentage of carbohydrate intake. Furthermore, diets that had a protein intake of greater than 1.05 grams of protein per kilogram that they weigh were associated with a greater fat-free mass retention than those who consumed less than 1.05 grams of protein per kilogram. It was concluded in the study that a low carbohydrate diet can increase the loss of body mass, fat-free mass, fat mass, and fat percentage during weight loss compared to traditional calorie-restricted diet. Typically, when trying to lose weight, if physical activity does not increase, then a decrease in caloric intake would have to occur. When consuming high-protein foods, since it takes longer for the body to digest proteins and fats than it does for carbohydrates, individuals are likely to experience greater satiety and therefore would feel less inclined to either overeat or continue to eat unhealthy snacks throughout the day. In 2007, Lady, Carnell, Matz, and Campbell studied how high protein intake preserves lean mass in addition to satiety with weight loss in pre-obese and obese women. The women in the study who consumed greater than 1.4 grams of protein per kilogram of weight compared to women who consume the recommended daily allowance of protein of 0.8 grams of protein per kilogram, experience a smaller reduction in satiety while also increasing mood and pleasure while losing body weight and body fat. The two groups consumed the same amount of total calories and kept the fat intake constant. To compensate for the increase in calories from the protein, calories from the carbohydrates were decreased. I think it should also be worth noting that when restricting carbohydrates too drastically and too quickly, people may feel less inclined to stick to a diet because they're ultimately unhappy. They feel very limited in their choices of food. They can't eat the same foods that everybody else is eating, so there's a social aspect to it. So that means that they are likely to start binging again on these unhealthy foods. To mitigate this, one can consider instead using low glycemic index foods as healthier carbohydrate alternatives. According to the Mayo Clinic, glycemic index is basically a number based on how food items can increase blood sugar levels compared to pure glucose. Low glycemic index foods are typically raw, unprocessed foods like most vegetables, legumes, nuts, and some fruits. Since these foods don't create rapid insulin spikes, there's no subsequent rapid drop in insulin and return to feeling hungry. Additionally, according to an article by Ludwig and Jenkins from 2004, blood glucose spikes that occur from high glycemic index foods subsequently cause spikes in blood triglycerides and lipoproteins, which in turn increases the risk of cardiovascular disease. So rather than oversimplifying this diet by categorizing it in high protein or low protein diet or high carbohydrate or low carbohydrate diet, it could actually be more of a high glycemic versus low glycemic index diet. So in conclusion, while general calorie restriction can lead to weight loss, consuming these higher levels of proteins while limiting carbohydrate intake and consuming low glycemic index foods can help to reduce overall cardiovascular risk factors while preserving fat-free mass and lean mass, and maintaining satiety and overall satisfaction, all while losing weight and treating your obesity.